Anatomy and pathology of head and neck malignancy. Anatomy of each primary site is described in subsequent sections. Lymph nodes, they are organized into levels. Level 1, which include submental, level 1A, and submandibular area, level 1B. Level 2 through level 4 include the internal jugular vein lymph nodes. Level 5 includes the posterior triangle. Furthermore, which lymph node levels are involved is predictive of the primary site. For example, lip, oral cavity, and facial skin tumors typically spread to levels 1 and 2 initially, with facial skin tumors also spreading to intraparotid lymph nodes. Larynx and pharynx have a predilection for spread to level 2 and 3. There are no capillary lymphatics in the epithelium. The tumor must penetrate the lamina propria before lymphatic invasion can occur. One can predict the richness of the capillary network in a given head and neck site by the relative incidence of lymph node metastasis at presentation. The nasopharynx and pyriform sinus have the most profuse capillary lymphatic network. The paranasal sinus, middle ear, true vocal cords, they have no capillary lymphatics. Muscle and fat contains few capillary lymphatics, as do bone and cartilage within the periosteum or perichondrium. There are no capillary lymphatics in the eye and few in the orbit. Most head and neck malignant tumors arise from the surface epithelium and are squamous cell carcinoma or one of its variants, including lymphoepithelioma, spindle cell carcinoma, verrucous carcinoma, undifferentiated carcinoma. Lymphomas and a wide variety of other malignant and benign neoplasm make up the remaining cases. Lymphoepithelioma is a squamous cell carcinoma with a lymphoid stroma and occurs in the nasopharynx, tonsillar fossa, and base of tongue. It may also occur in the salivary gland. In the spindle cell variant, there is a spindle cell component that resembles sarcoma intermixed with squamous cell carcinoma. It is generally managed like other high-grade squamous cell carcinoma. Verrucous carcinoma is a low-grade squamous cell carcinoma found most often in the oral cavity, particularly on the gingiva and buccal mucosa. It usually has an indolent growth pattern with pushing borders. Is often associated with the chronic use of snuff or chewing tobacco. Upper aerodigestive tract lymphomas almost always show a diffuse non-Hodgkin histological pattern.